I know one of the biggest problems Ebola people have had with Ebola is the fact that, like you said, there's a lot of fear about how it's even transmitted. It's not airborne, but people think it's airborne. Things like that. Everybody, you just hear someone cough and you're panicking. But we also know that children are most susceptible to catching anything. I mean, there's a flu in school, your child comes back with it instantly. There's Apollo or whatever it is, and he comes back with it. So this is why parents are scared. And I know you've made your clear point, but we know the condition of some secondary schools and primary schools in this country. Not everybody has a tap. Not everybody has. So you can understand why some parents are scared.
Yeah. Sure, and that's why I was happy with some of the points he made, but I want to actually reassure the parents and the community that at this stage, as a public health physician, I can say at this stage of this epidemic, there is no reason for the children not to go back to school. Because like the Minister of Health rightly said 2 days ago in one of his press briefing, he made an analogy to the fact that these children has been going to churches, they've been going to mosques, they've been moving around. We haven't closed their markets. So if we didn't close them markets, we didn't close them churches, we didn't close them mosques, we didn't close them mass gatherings. So there's no basis for restricting our children.
Isn't there the argument that in those places the parents are with them to watch who they get in contact with, as against a school where they run free?
Yeah, and in school, the teachers are with them. So what needs to be done, which is what the government had done from the start, is to carry along the school system. And we must not forget that before now there has been a school health program, which the schools are supposed to implement. But what now needs to be done is that we need to kind of strengthen that school health system such that there will be a little focus. Before now, you didn't care what happens to the school health program in your children's school. But I think the parents will begin to get interested. The parent-teacher association need to get on board where there are some schools where because the basis we have said is that most parents may not be able to afford sanitizers. So we're actually not emphasizing on sanitizer. We need basic water and soap to wash. So of course we do know there are some public schools or some other schools where that don't have this thing. So you will begin to collaborate with the stakeholders in the society to ensure that the schools where your children attend have this facility in place if they never existed before. And where it exists, you need to begin to enforce that they are used. And then of course checking. And then there's one key thing we have to remember, which is the fact that if your child is ill, there's no basis for any parent to send an ill child to school, or it should take that child to the healthcare center. And then now, like he was saying, that if you find someone, if the screening in school should happen, but if you find a child that is that has a temperature for so many other reasons, not Ebola, or it may be Ebola or not Ebola, and you don't send them home, you should actually assess the healthcare system. And in this case, if it's Ebola, you call the helpline. 0800 Ebola help. It's open there. Call the helpline, and of course, you should offer the basic necessary care as possible and the necessary precaution. Now, with all that on board, really, the likelihood of the school being a center for spread would be reduced. And then, of course, it's not only Ebola that's being spread in schools. Before, there are so many other infections these children pick from school. But just that Ebola has brought the platform where everyone can get concerned and work together to ensure that the school becomes a healthy environment more than ever before, that these children can come safely, because the school needs to be safe, or water should be at least be available in every school and all that, but all these are not there. But now the government should work together with the schools and then with the parents to ensure that these things are provided as much as possible, and everyone will be happy to see the result at the end of the day.
You are the president of Proprietors of Private Schools. So I know most private schools won't have a reputation to protect. So naturally, they wouldn't want their schools to be breeding grounds for anything. So I have two questions. These measures now that you put in place, are there mechanisms to monitor schools to make sure they are doing these things? And secondly, what is happening with the public schools?
Beautiful. I'll start from the last question. Recently, within the Lagos State metropolises, we witnessed that areas where there are no water supply, that borehole have been dug within these public schools. I witnessed some of them within the axis of Alimosho, Egbeda axis, and thereabouts, just about last week. And those areas that the water corporation system can easily supply water to, the Governor Washola has directed that such should be done immediately, and we are beginning to see where water are already running again in some condemned pipes that have not been used for a while. And one cannot but appreciate what the gentleman is doing in Lagos, and I wonder why any one of us would want to rubbish such good intention. Having said that, for private schools, there's no doubt that an average private school that is approved has what are running effectively within the school. And for those that are still processing their approval, there is no way you can have a private school running and you want parents to patronize you and the school will be short of water supply because the place will be so messy, will be so smelling. So that hardly happens within private schools. So the issue of water supplies is not our own challenge here at all. To measure that, to go around and supervise and monitor that our people are in line with directives we've given to them, is that we have adopted the collaboration of our PTA executive. Each school PTA executive is expected to, between now and Thursday next week, to give back to the association secretariat the risk assessment and evaluation reports done by the school, by the teachers, among which some of our executives also go around randomly to check. It is our opinion that when the PTA ESCO, where their own biological children attend, is giving a report on if the school had put all this plan in place, there won't be any form of malpractice in such reports, any form of negative report or cover-up will not happen because it affects them, they are stakeholder. So with that one, we are expecting a very reliable report. And you can also visit many private schools within the metropolises. You will find out that they've all, if not all, but over 90% have already comply with this.
Okay. Let's talk about Rivers State now, because Rivers State is a very interesting case now. I think the Nigerian Medical Association even mentioned that a state like Rivers, for example, should be different because, I mean, beyond Thursday, like you said, 4 Lagos people under surveillance. I think Rivers still has about 2 weeks before they can clear everybody from surveillance. And we even hear rumors, I don't know if it's true, about some people who were not even found still, people who had crossed over to other states. So should a state like Rivers, for example, resume, even if there are no Ebola cases confirmed?
Yeah, even if there's, like I said, there's no, since most of the people who have been in contact with the index case are under surveillance. And like we said, Ebola is not endemic in our community. It was brought in here, and since then we've been tracking everyone that has contact with that case. Yeah, and there's no basis why we should restrict everyone. The people under restriction are the ones that were in contact, and that's why what the surveillance system is doing. So really, practically everywhere, there's no reason why anyone shouldn't go to school, because these people, these contacts we are surveilling are not, they are not on the street, they are not in the schools. So
in addition to what he's saying, we are told, and I'm sure he's going to confirm that here, that except someone is very sick, such a person could not transfer such disease to another. So before someone can then be affected by the disease, we expect to have touched a corpse that is dead of Ebola, or someone that is sick of that sickness, very sick. And a seriously sick person won't be in a place like school, won't be in a place like market. And when there is sudden sickness developed within these public places, that is why people are being trained, not only in school, in the community, so that they know what to do when there is a sudden case of sickness. So Port Harcourt could open, and any part of this country could open, and what we need to do more is to ensure that an average individual in the street of Nigeria knows what to do when it comes to sudden sickness or a suspected case of Ebola.
Okay, I think that's the final word. So let's get a final word from you now and just wrap this up. Going forward, how safe do you think the country is now? What should we be doing going forward?
Yeah, the country needs to strengthen the port health service screening system, and they are doing that. And to the best of my knowledge, that is being done. Everyone needs to. This is not time to go to sleep. We don't have any case anymore. Doesn't mean we should all go to sleep. It means that everyone needs to work hand together, be more conscious of these hygiene practices, which will not only protect us against Ebola, but against so many other infectious diseases. And then, like we said, for parents who are not too sure what's happening in their children's school, this is a time to visit those schools and ensure that everything in that school is running well, so that not just for Ebola, for many other diseases, the children can bring home. So if everyone work together, really, Ebola is the last thing that will be scared of. Of course, like he also mentioned, the government is making plans, and they should also work hand in hand with the other states where this disease is happening.
And all of
yeah,
that, yes.
no, with state government and also with the countries where Ebola is still a problem, because it's important we solve that problem, help solve that problem there, because as long as that problem remains there, Nigeria and every other country in the world where people travel to are still at risk of the disease. So that's about what I think.
Thank you very much, Dr. Idokoko. Thank you very much, Chief Otubela. Just to confirm again, schools resume on the 22nd of September.
Absolutely. All of us are going back
across the country.
We advise parents to release their children for us. We are more than ready to take care of them. School is a low risk area, and teachers are always on monitoring to see the children that they are safe.
Thank you very much, sir. Thanks
you.
for being here today.
Thank you.
We'll take a break now and be right back with more. Please stay with us.